All right. Welcome in, everyone. Thanks for joining us today for this deep dive. We really tailor these deep dives to you all, and we know you're already pretty familiar with the basics of 340B, right?
Yeah.
So today, we're going to kind of like peel back some of the layers.
Yeah, get into the nitty-gritty, some of the nuances, I guess you could say, and especially some of the big shifts we've been seeing recently in the 340B world. Lots going on.
Absolutely. And to really get into it, we've got a couple of really interesting sources that we're going to be pulling from.
Yeah, so first up, we have this really fascinating discussion from the 340 Banter podcast. You familiar with that one?
I've heard of it, yeah.
Yeah, so they really dig deep into entity-owned pharmacies, which is something that more and more covered entities are looking at.
Right. Makes a lot of sense.
Yeah. And then, of course, we also have a whole bunch of recent headlines from 340B Report.
Always a good resource.
It is. Gives us that broad overview, like what's happening across the whole 340B landscape.
Exactly, yeah. So our mission today is to sort of synthesize all of that. Take all that information, pull out the stuff that's most important for you, and really, try to provide some clarity on where things stand with 340B right now.
And particularly, we always try to keep in mind, the perspective of covered entities.
Right, exactly. We know you all are on the front lines dealing with all of this. So let's jump in. Why don't we start by talking about entity-owned pharmacies? Like, what's the strategic thinking behind those?
Sure, yeah. I think what was really interesting from the 340 Banter podcast, they really emphasize the advantages that a covered entity can get when they integrate their pharmacy operations, directly into their system.
Yeah, and that makes a lot of sense, right? Like, I've heard you talk about how much you value efficiency, and it seems like having that pharmacy within the same healthcare system under, a single leadership structure could really streamline things.
Yeah. It really can. It's like having, everyone on the same page working toward that same goal and having that unified mindset can really make a big difference.
Right, exactly. And not only that, but it also seems like it could lead to a more patient-centered approach. Like the idea of having your medical care and your pharmacy services all under one roof,
Yeah.
all part of the same, I don't know, family, for lack of a better word.
Yeah, that one-stop shop concept. The podcast really emphasized how that model can improve patient care. And they got into the nitty-gritty of how it all plays out on the ground, especially in terms of communication and workflow.
I'm curious about that.
Think about a situation where a physician prescribes a medication, and then, the pharmacy needs some clarification, like maybe about a patient's other medications or an allergy or something,
Happens all the time.
all the time. And what the podcast highlights is that having the pharmacy right there in the same building can make all the difference.
Yeah, because then they can just like walk down the hall or pick up the phone and get that information right away.
Yeah, right. They have that direct access to medical records, and they can connect with the physician's team, the MAs, super quickly. It eliminates those frustrating delays that can happen when you're dealing with an external pharmacy.
Yeah, that back and forth, where you're like stuck in the middle and the doctor's office is trying to get a hold of the pharmacy and the pharmacy's trying to get a hold of the doctor's office. Like it's not a good experience.
No, not at all. And the podcast really drives home the point that this kind of integrated system can smooth all that out, which, again, aligns with your focus on efficiency. It just makes the whole process so much more seamless.
Right. Okay, so we've talked about some of the operational benefits. What about the financial side of things?
Yeah, so this is where the podcast offers a really critical insight, and it's something that I think a lot of covered entities might overlook. It's about the role of the accounting department in managing the 340B program.
Hmm.
Yeah, they kind of push back against the idea that you can just rely on your pharmacy's software reports to tell the whole story.
Oh, interesting. Why is that?
Well, because, pharmacy dispensing software it's great at what it does, right? Like managing prescriptions, inventory, all of that. But it's not necessarily designed with 340B compliance in mind. And especially, the financial reporting side of things.
Okay, so it's like the software might not capture all the nuances of the 340B program, or it might not present the information in a way that's like, easy for the finance team to use.
Right, exactly. And, sometimes you'll see health centers where the pharmacy team is kind of tasked with handling the 340B accounting as well.
Makes sense, right? They're the ones dealing with the medications.
Yeah. But the podcast really pushes back against that approach. They argue that pharmacy staff might not have the same level of expertise when it comes to 340B regulations as, say, a dedicated finance team would.
Yeah, like they're experts in medications, not necessarily in the intricacies of the 340B program.
Right. So what they're really emphasizing is that your accounting department needs to be actively involved. They need to understand the 340B program itself, how to pull the relevant data from the pharmacy system, and then how to interpret it correctly.
So it's not just about like, the pharmacy doing their thing and then handing over a report to the finance team. Like the finance team needs to be in the loop from the get-go.
Exactly. They need to be able to look at that report and say, okay, does this make sense in the context of 340B? Are there any red flags here? Anything that might cause problems during an audit? They need that deeper understanding of the regulations to really provide that financial oversight and make sure the program is running smoothly.
So having that expertise on the finance side is really crucial for maximizing the program's benefits and ensuring compliance.
Absolutely. They even talk about how there can be a disconnect between what the pharmacy software spits out and what, accounting principles require, especially when it comes to 340B.
That's interesting. So it sounds like the podcast is really advocating for like, a more collaborative approach between the pharmacy and the finance team, right? Like a true partnership where they're both working together to make sure the program is successful.
Right. It's all about communication, making sure everyone's on the same page and that everyone understands the big picture.
I like that. Okay. So I know the podcast also touch on the importance of communication between the pharmacy and the medical departments as well. Even within the same entity, those two can sometimes feel like they're in separate silos.
Yeah, they mentioned that. And they recommend setting up, regular communication channels between those two departments, maybe even like committees or something like that that can bring people from both sides together on a regular basis.
Right. So that there's that ongoing dialogue and everyone is, aware of what's happening. Why is that so important?
Well, it goes back to that idea of a unified approach, right?
Yeah.
Making sure that everyone understands the goals of the 340B program, how it operates, what the limitations are. It's not just about, the pharmacy generating revenue. It's about how that revenue supports the covered entity's mission of patient care. When everyone's on board and working together, you can really optimize the program's
Yeah.
impact.
Right. You get that synergy.
Exactly. And, on the flip side, if there's a lack of communication, if people are operating in silos, that's where you start to see inefficiencies, missed opportunities, that kind of thing.
Yeah. Things fall through the cracks.
Exactly.
Okay, so we've talked about the need for internal alignment, communication between departments, all of that. What about the external factors? The pressures that covered entities are facing in terms of maintaining their 340B programs.
Right. So, the 340 Banner podcast also touches on this. They talk about the importance of having realistic expectations for the entity-owned pharmacy,
Yeah.
like especially when it comes to the financial side of things. They caution against viewing the pharmacy as like this automatic, unlimited source of revenue.
Yeah, I mean, it's not a magic money tree, right?
Exactly. And they really stress the importance of grounding those financial projections in reality. Like what's your patient volume? How well are you capturing those prescriptions? Those are the kinds of things that need to be factored into those financial forecasts.
Right, so you're not setting yourself up for disappointment or creating unrealistic expectations.
Exactly. And it also helps with, long-term financial planning for the whole entity, right? When you have a realistic picture of what the pharmacy can contribute, you can make more informed decisions about how to allocate resources and all of that.
Makes sense. Now, one last thing I wanted to touch on from the podcast. They talked a lot about the need for education, right? Like making sure that everyone across the organization, from the top down, understands how the 340B program works and why it's so important.
Yeah, that was a big takeaway for me too. They really make a compelling case that education is key to a successful 340B program. You need buy-in from everyone, from the leadership team to the frontline providers. Everyone needs to be on the same page.
Right, because if people don't understand the why, they're not going to be as invested in making it work.
Exactly. So they talk about, making sure the executive team understands the strategic value of the 340B program and that all the providers, especially new staff during orientation, they get that training on how it works, how the entity-owned pharmacy fits into the picture, all of that.
It's about building that culture of understanding and support for the program, right?
Exactly. Okay, so we spent a lot of time talking about the internal dynamics, the operations, the finances, the communication, all of that. But of course, we also need to look at the bigger picture, right? The external environment that covered entities are operating in.
Exactly. And to do that, let's shift gears a bit and dive into those 340B report headlines that you mentioned earlier, I mean, just glancing through them, it's clear that the 340B landscape is constantly evolving, right? And there's a lot of tension out there.
Oh, absolutely. I mean, just the sheer volume of news coming out is an indicator of how dynamic things are.
Right. And one of the things that really jumps out, at least to me, is all the legal back and forth around contract pharmacy access. These ongoing battles between drug manufacturers and covered entities. It seems like it's a real point of contention.
It is, and I think it highlights this fundamental disagreement over how the 340B program should be implemented. On the one hand, you have covered entities who are trying to leverage contract pharmacies to expand access to affordable medications for their patients.
Right. And that makes sense, right? Like if you're a covered entity and you don't have your own in-house pharmacy or you're trying to reach patients in rural areas, contract pharmacies can be a lifeline.
Absolutely. But then on the other hand, you have the drug manufacturers who are, pushing back against that, trying to limit the use of contract pharmacies. They're arguing that it's outside the scope of the 340B statute, that it's being abused, that kind of thing.
So it's like a tug of war, right? With the covered entities pulling in one direction and the manufacturers pulling in the other.
Exactly. And that tension is playing out in the courts, in the legislature, everywhere. So, for example, we saw that headline about a federal judge dismissing 2 drug maker challenges to Minnesota's contract pharmacy access law. That's a big win for covered entities.
It is. It suggests that, at least in some cases, the courts are siding with covered entities on this issue, and that those state laws aimed at protecting contract pharmacy access can hold up.
Right. But, it's not all good news. On the flip side, we see companies like Bayer and EMD Serono, they're extending their restrictions on contract pharmacy
It
arrangements.
was a mixed bag, right? Some wins, some losses.
It is. And that's why it's so important for covered entities to stay informed, to be aware of what's happening, and to be proactive in advocating for their interests.
Absolutely. And it's not just the courts, right? Like, we're also seeing action at the state level. I mean, we saw headlines about Missouri's contract pharmacy access law taking effect and Arkansas enforcing its law against AstraZeneca. That's a big deal.
It is. It shows that states are recognizing the importance of this issue, and they're willing to step up and protect their covered entities and their patients.
And it's not just those 2 states, right?
Mm.
Like, we're seeing similar legislation being introduced in other states as well, like Ohio, Delaware.
Right. It's a trend that's gaining momentum, which is encouraging. It shows that there's this growing recognition that contract pharmacy access is vital for ensuring that patients can get the medications they need at a price they can afford.
It's about equity, right? Making sure that everyone has access, regardless of where they live or what their circumstances are.
Absolutely.
Okay, so we've talked about the legal battles, the legislative efforts. What about the drug manufacturers themselves? Like, how are they responding to all of this?
Well, as you might expect, they're not just sitting on the sidelines, right? They're also trying to shape the program in ways that they see as beneficial to their interests. And we see that reflected in the headlines as well.
Right, so it's not just about fighting against contract pharmacies. They're also trying to, influence the program in other ways.
Exactly. So, for example, we saw that Merck and GSK are offering refunds for past overcharges. Now, you could see that as a positive step, right? Like they're acknowledging that there were issues and they're trying to make things right.
Yeah, it could be a sign that they're trying to, be more collaborative, to work with covered entities to find solutions.
Maybe. But it could also be seen as a way to head off potential legal challenges, right? To avoid bigger problems down the road. So, it's hard to say for sure what their motivation is.
Right, it's a bit ambiguous.
Right.
What about J&J? I mean, they've been in the news a lot lately with their proposed rebate model.
Yeah, that's been a big story. And it's a more proactive approach, right? Like instead of just reacting to what covered entities are doing, they're trying to fundamentally change how 340B discounts are applied. They want to shift away from the current system of discounts at the point of sale and move towards a rebate system.
And that's raised some eyebrows, right? Like, HRSA has come out and said that it's not consistent with the 340B statute.
Exactly. And that's a significant statement, right? It shows that HRSA is paying attention and they're not afraid to push back against manufacturer efforts that they see as undermining the program.
Yeah, it's a reminder that HRSA is the ultimate authority here, and they're going to be looking closely at anything that could impact the integrity of the 340B program.
Absolutely. Okay, so we've talked about the legal and legislative landscape, the actions of the manufacturers, but there's another trend that's really emerging, and it's all about data.
Data.
Data, like the importance of having robust data management systems, strong analytics capabilities, all of that. We're seeing more and more emphasis on this, both from HRSA and from industry experts.
And I imagine that's only going to become more important as the program continues to evolve and face these external pressures.
Absolutely. And that's one area where a good third-party administrator, like our sponsor, Aventi Health, can really make a difference. They understand the complexities of 340B data management, and they provide innovative solutions to help covered entities stay on top of it all.
Right, because it's not just about collecting data. It's about being able to analyze it, to identify trends, to spot potential compliance issues before they become problems.
Exactly. And with all the changes happening in the 340B world, having that kind of data expertise is becoming more and more critical.
Right. You need to be able to, like, see the forest for the trees, so to speak.
Exactly.
Okay, so we've covered a lot of ground here. We've talked about the internal dynamics of entity-owned pharmacies, the external pressures from manufacturers and regulators, the importance of data, and so much more.
Yeah, it's a lot to digest.
It is. But hopefully, this deep dive has given you a clearer understanding of the current state of the 340B program and, some food for thought as you think about your own program and how to navigate this complex landscape.
Exactly. And I think what's really important to remember is that all of these things are interconnected, right? The internal and the external are constantly influencing each other.
Right. So, like, the decisions you make about your internal operations, your pharmacy, your finances, all of that can impact your ability to respond to those external challenges.
Absolutely. And vice versa, right?
Right.
The changes happening in the courts, in the legislature, they're going to have implications for how you manage your program on the ground. It's all connected.
So it's really about having that holistic view, that strategic mindset, where you're constantly looking at both the internal and the external factors and adjusting your approach accordingly.
Exactly.
I like that. Okay, so as we wrap up here, so I want to leave you with one final thought, something to kind of chew on as you move forward.
Okay, I'm listening.
So we've talked a lot about, the importance of internal alignment between departments, communication, all of that. But I think it goes even deeper than that. It's about creating a culture of 340B awareness across your entire organization.
Yeah, that's a great point.
Like, it's not just about the pharmacy, the finance team, the medical staff. It's about everyone understanding the value of this program, how it benefits your patients, and how it contributes to your mission.
It's about making 340B part of your organizational DNA.
Exactly. And when you have that, when everyone is bought in and understands the why behind what you're doing, that's when you can really make a difference.
Thanks for joining us for this deep dive. We hope you found it valuable, and we encourage you to keep exploring these issues and to share your insights and experiences with us as well. We're all in this together.